And thanks for joining us here at KW Q&A. This entire half hour, we're focused on answering your questions about the coronavirus pandemic. Let's start with something that's making a lot of headlines right now, a possible treatment for COVID-19. Today, White House advisor Dr. Anthony Fauci talked about a promising drug trial, calling it good news. Remdesivir is an antiviral medication. Dr. Fauci says patients treated with it had a 31% faster recovery rate than those patients who were given a placebo.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important for a number of reasons.
Now, Providence Medical Center here in Portland is one of the locations where that drug is being tested in clinical trials. Providence infectious disease doctor Tobias Push tells us exactly what it is and what did the trial results show.
So remdesivir is an antiviral agent that was created initially for the Ebola response back in 2014. And was not designated necessarily to be a drug for other viruses, but it turns out that it has broad spectrum activity against many so-called RNA viruses, including SARS-CoV-2, the COVID-19 coronavirus inducing virus. The results indicated that no matter which time frame you were assigned to, 5 or 10 days, the outcome was similar. The patients were on average discharged about 4 or 5 days earlier than patients not receiving remdesivir, no matter how long you were treated for.
And just a reminder here, an important reminder. Now, this drug should only be used in trials under medical supervision. You should not ask your doctor to prescribe it for you or try to self-medicate. All right, now let's bring in Dr. Claire Wheeler, a public health specialist from OHSU and Portland State University, to answer some more of our medical questions. So, Dr. Wheeler, this is an important one. As testing ramps up, we're seeing more and more drive-through test sites. Is a drive-through test just as accurate as one you could get at a doctor's office?
The short answer to that is almost certainly yes, because the drive-through part is just where they collect the sample. So the whole point of the drive-through is to make it as safe as possible for you to get tested. So you just pull up, roll down your window, they take the swab. After they take the swab, they put it in the tube, and then it goes to the same lab, basically, that it would go to if you got the swab taken at your doctor's office. So it's really an advantage to be able to drive through and get that swab done.
Okay, great. I know we're hearing about a lot of different symptoms, and can you tell us about, some skin conditions that might be signs of hidden COVID-19 infections?
Mm-hmm. Yeah, I guess they're calling it COVID toes. Mm-hmm. And it's interesting, people are seeing that. We're seeing this in 2 groups of patients. Number one, the younger people who seem to be having a less severe infection with this virus are showing these purple splotches that you can see in the pictures on the extremities primarily, but in other parts of the body as well. And that seems to be kind of something similar to what we see in lupus. Like, in lupus, you have that rash on the face. Here, the butterfly rash, and that is because the immune system is being a little bit rough on the blood vessels that are serving the skin. And so that the theory is that that's what's causing this in young people. And I wouldn't call that a hidden symptom. I would call that a newly recognized symptom. We have to remember that this virus can bind in many different places in the body and kind of get out of the box we've been in of thinking of this as a respiratory illness only, because it can cause kidney failure, neurological symptoms. It can infect you just in your GI tract, or it can produce symptoms like this. And it's really important that we have a very good, reliable list of symptoms so we know who to test when those symptoms appear.
That makes sense. And let's talk about antibody tests. What are they telling us about this virus and the pandemic?
Yeah, big study came out in the Washington Post recently because were able to step up testing so much in New York City, and what they found was that there are so many more people infected than they realized before. And it looks like, just based on those numbers, there may be 10 people who are infected for every 1 person who presents as a quote-unquote case. And so that's good news and bad news in that, you can have a lot of people who are infected who don't actually get super sick, but it also means that this virus is a lot more contagious than we thought it was based on how many people have antibodies for it. And if they have antibodies, that they may be immune now, but we don't know how long that immunity will last. And so it's helping us with our numbers in terms of planning and being able to predict what's going to happen if we loosen our social restrictions, because with that many people out there who have infections, then as soon as we lighten up on the social distancing, we could see another curve start pretty quickly.
Great. Dr. Wheeler, thank you so much for joining us, and as always for the great information. You know, we're learning so much about this, and you really help us, sort everything out. So thank you.
Thank you. Take care.
So while we're talking about antibody testing, one big question, should we all get one or not? Pat Doris has some answers.
Antibody testing is going to be the next big thing in the testing push for COVID-19. It's not very available right now in Oregon, but it will be. It's available in places like New York right now. But what it does is it tests for the antibodies in your body that were created to help fight off the infection. And so the scientists can go in, find that, and know what your body was fighting. The question is whether it will be helpful for us as individuals or just for epidemiologists. The doctors say that epidemiology-wise, it's going to be great because you'll be able to tell if the infection has spread through a large population or only partly through that large population. The big problem becomes when you and I start to get the test and then we decide what it means for us. So with most things, if you get the flu and you get over it, you feel bulletproof. The doctors warn it's not going to be that way with COVID-19. But I think that most people are still going to feel reassured. If they have the antibodies, they'll figure they got just a minor case of it and now they're good to go. The doctors say you shouldn't, but I think that is what will happen. We'll see. That's what's going on with antibodies.
At any time, you can send in your questions, and there's a new number to text. It's 503-226-5088. Now, if we don't get to your question tonight, we'll be answering your questions right here at 7 o'clock, Monday through Thursday. And welcome back. Tons of people are out of work right now. The financial company MoneyGeek says when the unemployment rate reaches its peak in Oregon, it will be more than twice as bad as the Great Recession a decade ago. So what should people do to save money while waiting for unemployment benefits? Here's Galen Etlin with some answers.
For some quick context, MoneyGeek says about 10% of Oregon's workforce has applied for unemployment in the last 5 weeks. And at the peak of this crisis, MoneyGeek forecasts Portland's unemployment rate will reach 27%. That's 356,000 people struggling to help their families. Now that number is more than twice what we saw during the 2008-2009 recession. So what do you do? If you're looking for work and applying for unemployment benefits, great, keep it up. But also, Doug Mills with MoneyGeek says find ways to cut spending on smaller monthly bills too.
There may be some big ticket opportunities as well. MoneyGeek has resources that can help you refinance your mortgage or lower your spending on auto insurance, which are kind of big ticket monthly items that if you could clear up a couple of $100 could make a big difference.
And reach out to your creditors, explain your situation, and agree to a plan that could push your bills back or help you pay less. That goes for credit cards, medical expenses, and mortgages.
Now, on top of being out of work, a lot of people are also worried about how they're going to pay off debt, like student loans. So, does the Federal CARES Act give you a break on student loans? Our Verify team looks into it.
The Verify team is here to answer your questions and break down rumors spreading online. And we've gotten all sorts of questions about the CARES Act and how that will impact student loans. First, let's break it down.
Hi, my name is Henry Grez.
Our expert from the Association of International CPAs says the CARES Act does two things: defers all payments on federally owned student loans and sets interest rates on those loans to 0% through September 30th. So let's get to the questions. Here's viewer Crystal Mitchell.
Why are loans under the Federal Family Education Loan Program, better known as the FEL program, excluded from the CARES Act?
Well, it turns out it's all about who owns the loan. Our expert explains that private loans are excluded, as are federal loans owned by commercial companies or universities. So let's take Crystal's situation. When she first got her FEL loan, it would have been covered by the CARES Act. But since it's been purchased by a commercial company, it's now excluded. Grez says people like Crystal should still call their lender and ask for a break. Okay, next question. This person on Twitter says we should all be taking advantage of the 0% interest, saying if you can, pay your loan, even though it's deferred.
I would say yes. I would absolutely say yes.
Our expert said this is verified. Since you're not paying any interest, the money all goes to what you owe. But before rushing to pay, Grez says you should first take a look at your other accounts.
If they have other debt that they're also carrying at a much higher interest rate, use the funds for that higher interest rate loan.
Also, at a time like this, putting money towards savings is not a bad idea. Now, if you have any questions about all this or anything else, shoot us an email.
Now let's talk about workplace safety. A KGW investigation found that in several cases, nursing home workers called for help before the outbreak turned deadly. So what concerns did these healthcare workers have? Here's investigative reporter Kyla Boshi.
We've certainly heard concerns from health workers before, but some newly released records help to illustrate what's happening at long-term care facilities, which sadly have been hard hit by the coronavirus outbreak. These records come from Oregon OSHA, that's the agency that oversees workplace safety, and they show that a number of healthcare workers actually complained in advance of this surge that we've seen of coronavirus deaths. These workers complained, listen, we don't have enough equipment, masks specifically, also some gowns. They said in some cases they didn't have proper training, and in a couple instances they said they were asked to come back to work despite testing positive for COVID-19. We reached out to these long-term care facilities. A couple of them said, listen, that just isn't the case. We investigated those claims, they say, are false. Nonetheless, the workers say their voices matter. They're truly important because they're on the front lines.
All right, thank you, Kyle. Are blood clots linked to COVID-19? And what problems could they cause in your body? That answers up next. But first, another quick Q&A. Is there a risk of COVID-19 spreading from mosquito bites? The answer, no. Coronavirus is not a blood-borne pathogen. Every virus has a specific handle on the body where it locks on, and the coronavirus locks onto cells in the airway and the gut.
Doctors in Europe are warning about a rare illness they are finding in children that may be linked to coronavirus. So what is Kawasaki disease and how does it affect kids? Let's connect the dots. Doctors in Britain, Italy, and Spain sent a warning to fellow childhood illness specialists about a small but rising number of children becoming ill with a rare disorder. They reported a small rise in critically ill children who tested positive for COVID-19 who presented with symptoms of Kawasaki disease. That is a rare childhood illness that causes the walls of blood vessels to become inflamed. Symptoms include a high temperature that lasts for more than 5 days, rash, swollen glands, and red bloodshot eyes. It is treatable and not contagious, but if not caught early enough, can lead to serious heart problems. Scientists are still not clear what the link is between coronavirus and Kawasaki disease. So far, the CDC reports children diagnosed with COVID-19 typically have mild cases of the virus. But there have been deaths reported, so cases in children should be taken seriously. Connecting the dots, I'm Janelle Vluda.
And here's another worrying coronavirus side effect. Doctors are seeing more blood clots in patients with the disease, and they're finding them all over the body, from the legs to the kidneys, all throughout the lungs, even the brain. So are blood clots linked to the virus? Here's neurologist Dr. Fadi Nahab.
The clots in the veins involving the legs, the arms, the clots in the lungs are definitely at an increased frequency in the COVID-19 patients that we typically see with other viral infections. So I think that association is definitely there.
Here's another question. How do these blood clots affect the body?
The biggest risk is that this type of clotting in the veins can actually go up to the lungs and actually cause difficulty with breathing, decreased oxygen levels, requiring patients to be on a ventilator machine. Again, clots can affect the arteries, but just we're seeing that less commonly occur than clots in the veins. So less commonly we do see clots that can cause stroke, or less commonly can cause a heart attack as well.
What is the best way to put on a mask without possibly contaminating yourself? We'll have the answer coming up. But first, here's another quick Q&A. Is pink eye related to COVID-19? The answer, it can be. In a study published by Chinese doctors in March, some coronavirus patients had eye-related symptoms like pink eye. It's important not to touch your eyes unless you know your hands are clean. And welcome back. More than a dozen states are starting to ease restrictions. And even though we're still mostly locked down here in Oregon and Washington, what should people keep in mind when things start to reopen here? I asked Dr. John Torres.
So even though restrictions are easing, a lot of us have what some people are calling quarantine fatigue, meaning we've been inside so much, we just want to get out and do things. You have to be careful, and you have to make sure that you're taking all the precautions, social distancing. If you're in an area where you should be wearing masks, then wear masks. At the same time, wash your hands as often as you can. But the important thing to remember is once we start getting out and about, cases are going to rise. So start listening to the public health authorities, keep an ear out, and if you start hearing about them instilling more precautions and more restrictions, then follow those guidelines, because we want to make sure we don't have a repeat of kind of the wildfire of cases we have now, just to keep it under control. So if there are hot spots, we can control those and more people don't get sick.
All right, speaking of masks, some places like New Seasons, Costco, several grocery stores, they're now requiring them. I asked Dr. Pale Coley, what is the best way to put on a mask to limit contamination?
I like to make the analogy that I like to think of my mask like underwear. So you don't want to touch it all over the place. You just want to touch it right at the edges, and you really want to try to wash it, ideally every day, but if you can, even more often than that. So I wash my hands and I pick up my mask just by the edges of the straps there, and then I hold it like this, and then I just loop it onto my ears like that and like that, and then I only touch it up here and here, and then I wash my hands again because I've touched it. Then I don't touch it again after that, and then when I'm taking it off, I do like this, and then you just kind of move it away from you as fast as you can. Put it in a paper bag so it's not touching other surfaces. The mask is not getting dirty, and you're also not contaminating other surfaces. And for women, I would strongly recommend actually tying up your hair, either in a bun or in a ponytail. One, because you don't want your hair to be touching the outside surface of the mask. Second, because if your hair is down, you're much more likely to touch your face if it flies around in your face. And then finally, if you actually tie up your hair, your mask is probably likely to fit a little bit better as well, because it's not interfering with your hair as you're putting it on.
All right, thank you so much for joining us tonight. KGW is committed to answering your questions about the coronavirus. If you still have questions, our past stories may answer them for you. Go straight to kgw.com/answers to see all of our past Q&As.